Hello, everyone. We have an interesting topic for today's episode, and I'm Dr. Susan Protasio, your host. Psychosis is one of the symptoms of many mental health conditions, and it is not openly talked about because there is a stigma associated with it. So what is psychosis? So I would like to share with you a new specialty mental health program in Riverside University Health System here in California. And it is called the First Episode Psychosis Program. And our guest today will give us more information about it. He has a degree in Bachelor of Science in Psychology, a Master's in Marriage, Family, and Child Therapy from the University of Laverne, California. And he is the supervisor of this new program, the First Episode Psychosis Program. So let's welcome our guest, Mr. James Gaylor. Welcome, James.
Hi, Dr. Susan. Thank you so much for having me on today.
Yeah, thank you for your presence. So could you please share something about yourself to our audience?
Yes, absolutely. So I was born and raised here in Southern California, so I'm a native to the area. I was born and raised in the Coachella Valley area, so I'm raised in a very rural part of California here. And spent most of my time in my youth traveling the country for martial arts, actually.
Oh,
and
that's
then
nice.
as I got older, I went to the East Coast for college. Found it to be a little too cold, so I came back to California to expand my career and my education again, and got my master's at University of Laverne. That allowed me to meet my lovely wife and have our three amazing children here in the Southern California area.
Okay.
So that I could continue to give back to the community that helped to raise me. So it's definitely a blessing for me to be able to give back to this area,
Yes.
and especially to work with this population that has such a big need and is underserved. So I really look forward to continuing to serve this area.
Yeah, that is so true. So thank you for sharing that.
Thank you.
So can you tell us what is this First Episode Psychosis Program is about?
Yes. So to start, there are actually several first episode
Okay.
psychosis programs globally, and it's
Okay.
actually becoming larger here in California. So our program specifically, I can talk a little bit more about my specific program here in RUHS. So we work with youth between the ages of 12 to
Okay.
26 who have recently experienced their first episode with psychosis.
Okay.
So one of the big goals that we have
Okay.
for the First Episode Psychosis program is to help a person to manage their symptoms
Okay.
of psychosis. And we do that to help them to stabilize those symptoms. We do that through behavioral health services.
Okay.
So part of those services may include psychiatric services and clinical services with a therapist doing a specialized therapy, as well as with a peer support who provides that lived experience.
Okay, that's nice.
yeah.
That's nice. So from the perspective of this program, what is psychosis?
So from the perspective of this program, kind of the simple way to say it is that it is when a person has a hard time telling the difference between what's real and what's not real. A more complex way of saying it would be that there is a genetic predisposition that gets combined with an environmental stressor. So we call it a stress diathesis model. So someone who may have a genetic predisposition from family history,
Right.
and then has some stressors in their life, whether that's school, family, work, what have you, that causes that episode to begin.
Right. So the psychosis is not just it's not a single disease. It is a set of symptoms that leads to like disconnect with reality, right? So what are the signs and symptoms of psychosis that you see in your program?
Yeah, so within our program, the most common signs and symptoms that we see would be hallucinations and delusions. So hallucinations would be when someone is seeing or hearing something that's not there, something extra with their sensory perceptions. And a delusion is when they have a very fixed, unshakable belief, even in the presence of evidence against it. So someone who believes that the government's out to get them, or believes that maybe they have a special power, even when evidence to the contrary is presented to them.
Is there like an increased substance abuse use in those patients that you see there?
Absolutely. In our population between 12 and 26 especially, we see a lot of substance use. And there's two main reasons for that. One may be that the substance use may actually be that environmental stressor that can induce that first episode of psychosis. Or, on the other hand, it could be that somebody is using the substances to self-medicate when they do have that
Oh.
first episode itself.
Okay, so they think that that's the way to, medicate and lessen the symptoms. So what are the most
Yeah.
common substance abuse that you encounter in your program?
The most common would be, at this point, is marijuana, especially here in California. It is
Yes.
being used a lot, and it does have a psychoactive component to it, which can increase that first episode. Or someone who already has those symptoms, it can actually increase the frequency and intensity of them.
Right, right. I would like to share this information from the National Institute of Mental Health. It says that when a person is about to manifest psychosis or symptoms, they would have a change in their behavior. And the behavioral warning signs would include suspiciousness, trouble thinking clearly and logically, withdrawing socially, and spending a lot more time alone. And there is also a decline in self-care or personal hygiene. And then the sleep is disrupted. And then, like you said, there is a difficulty differentiating the reality from fantasy, right? And there is a sudden drop in grades or in job performance. And there is also sometimes a confused speech. So in general, this person that manifests these changes, it could be lumped up into like anxiety or lack of motivation or emotional disruption, and sometimes difficulty functioning over time. So that's why if they have a job, the job performance tended to kind of slide down, and then until they lose the job, right?
Exactly, and we call those, we call it prodromal symptoms, things that happen before they have the psychosis
Right.
itself.
Right.
And it usually starts and manifests a couple of months before the psychosis happens, and we'll see a change in their behavior.
Yeah.
So they're again sleeping more or sleeping less,
Yes.
changes in appetite, changes in their thoughts and behavior patterns. Most notably at this age range, we're looking at the changes in school and work,
Yeah.
which is why
Yes.
one of our main goals
Yeah,
for
yeah.
the program is to, we call functional recovery.
Right.
So getting them back to school, back to work, and finding some sense of meaning for them in their lives so that they can get back to what they would like to do.
Once the psychosis symptoms are stabilized. So you mentioned about the theory of causation with regards to psychosis. So can you explain what is that about?
Yes, so what we do is we talk about what's called the stress bucket or the stress diathesis model. So the stress bucket is a great visual representation of it.
Okay.
So with that, we say that there's that genetic component that everybody has. So
Okay.
someone who has a family history, a parent, a grandparent, someone else who may have had some kind of psychosis-related disorder. And that determines how big their bucket may be and how much stress they can handle, how much can fit into it. There's different environmental stressors that can go into this bucket.
Right.
So we kind of imagine little spigots of water that fill this bucket up, and that might be environmental stressors from school, from
Right.
work, from family, financial stressors,
Okay.
different things going on within the country. And as that bucket fills up, then their symptoms may get more prominent. Someone who is anxious might start feeling paranoid now.
Right.
At the bottom of this bucket, we also have more spigots to let the water out.
Okay.
And those are the coping skills and stress management skills that we want to really reinforce. So when we're looking at how this applies to first episode, when there's more water going in, more stressors going into this bucket than there is going out, eventually the bucket's going to overflow.
Right.
And that is where we see the first episode, when the water is flowing over the edges. That is when we're going to see hallucinations, delusions,
The
those fixed
symptoms.
beliefs, exactly, the disorganized thinking, and that's where someone's more likely to be hospitalized or need additional supports.
Yeah. So that overflowing of the bucket, it sounds more like the stressors is overwhelming the patient.
Yes.
And then if they have this genetic predisposition, then they manifest the psychosis symptoms, right?
Exactly.
Yeah.
And one of the reasons I really like this model is that it shows that, for the most part, almost anybody can have this have
Right.
this experience.
Right.
Just because their bucket may be larger, if they have more stress, then they may also be at risk as well.
Yeah.
So that's why it's important to have these effective coping skills.
Right, right. And then for the audience, I would like to share that when we say genetic predisposition, it means that there is an increased likelihood of developing the disorder based on the person's genetic variations that is inherited from the parents.
Okay.
And also this theory of causation, there are two elements here that are in play, right? So the diathesis is where the person is predisposed to have the mental disorder, and now you have the stress adding in. So the interaction of those two would cause the manifestations of mental disorder, right? So the stress and those two, so that's why we see individuals with family history of mental illness, but that person never had a mental disorder because probably the stress is not that big, or he has a good coping skills, and he's not overwhelmed. So that's the reason I think the, the practical application of that theory that you explained to us. So thank you. That's a very nice theory. So thank you so much.
Thank you. You're welcome.
So how are patients brought to your program?
Yeah, so there are 4 main ways they make it to our program.
Okay.
One is if they are already part of our system of care within our Riverside University health systems, then the person they're already meeting with, that therapist or that psychiatrist, may identify that they are experiencing that first episode and would refer them directly over to us with that with the person's permission. If they're not part of our system of care, sometimes it may be because they have a hospitalization. And so if they are a danger to self or danger to others, when they go to the hospitals then identify that they're experiencing psychosis. And then they will identify that we may be an appropriate program for them. And usually they will get routed over to us that way. The third way that someone can be referred over to us is actually through the school districts. So we're doing more outreach with the schools so that they're aware of what to look for within their student population, what some of those early warning signs may be. And then the schools will refer over to us directly, again with the member's permission as well as the parents. And the last way is, the fourth way would also be through a self-referral. So the self-referral means somebody who is aware, maybe they see this on the podcast or they have seen us at one of our community outreach events, and they identify that they may be experiencing it and would like to be screened for and get some services. They would call our main number, which is 951-358-6005. And then they can ask for some information and we can get them scheduled in.
And they could come in and present themselves, and then they would be they'll be availing the services that your program has.
Exactly.
Right. How about that? Let's say a patient is hospitalized and had the psychotic symptoms, and so after discharge they get referred to your program. Is that how is it done after discharge?
Yeah, usually for a hospitalization after discharge, depending on their age, sometimes they may go through a specialized program that is kind of like an intermediary, and they are, for the case management, refers over to us. So they'll help to kind of make that bridge. For the adults, typically they're given our information and told to go ahead and call themselves if they would like to do that voluntarily.
So that's nice. So, you know, psychosis is associated with the fear of the person experiencing the psychotic episodes, right? And we thought like there's a danger if this person is having that symptom. So can you share your thoughts on the stigma associated with psychosis?
Absolutely, and stigma is a huge part of this symptom and of this disorders. So when it comes to the stigma of it, a lot of times the stigma is around the idea that people don't have a lot of information around it. They aren't aware of how they should support the person because they're experiencing reality in a different way. And so a loved one may not know how to talk to that person. They may want to tell them that what they're experiencing isn't real. So what I'd like to do is give a little bit more information, a little psychoeducation to everybody on how to do that. The first thing we say is we want to collaborate and not collude with a person. And by saying that, what we're meaning is what they're experiencing may not be real in the sense of what they're perceiving reality, but the emotions around it is, their feelings around that is. And so as long as we, as humans, can make that connection to them, that helps them to feel supported. And with that support, they're less likely to socially isolate. And that isolation is actually what leads to being a danger to self or others because they're kind of stuck in a vacuum. And we want to get them additional support, additional interactions with their family, with their friends out in the community. And that stigma, it comes in 2 forms. It manifests in 2 forms. We have the public stigma, where the society has a negative attitude towards the person experiencing the psychotic symptoms. And the other one is the internalized stigma, where this person experiencing the psychotic symptoms, they would adapt now to the negative attitude towards themselves. So now it affects their self-esteem, and at the same time, like you said, they're no longer willing to seek help because of the stigma attached to it. Exactly.
You know?
Exactly. And there's a lot of myths out there, and one of them is, and there's a word that gets thrown a lot of, oh, I must be crazy. And that is a word we really want to really downplay a lot in our program, is
Right.
that is not true.
Yeah.
A lot of them are able, a lot of people who have experienced psychosis are able to live normal lives. They are able to work, go to school,
Yeah.
have relationships and families.
Yeah.
And that's a big part of it. And it starts with having that human connection. And perhaps one of the most effective ways of doing that is what we call the LEAP model. So that stands, so the L is for listen, E is for empathize, A is for agree, and P is for partner. So what that means is we want to, again, acknowledge that what they're experiencing is real. We want to be able to listen to them without challenging them and saying that's not real.
Yeah.
We want to understand what their
That's-
experience is.
Yeah. So that's a big help. And with regards to stigma, in other cultures, I'm Asian, so in our Asian culture, there is the stigma when, let's say, your family member has a mental health problem. They don't want to seek, like, the professional mental health services because the family would be labeled like it's like a crazy family, or you have all this craziness. So there's always that stigma. So I hope by listening to us that you would know that this psychosis can be helped. These people experiencing, the symptoms can have a productive life.
Absolutely, absolutely. And another part of it is a big community where there's a lot of stigma around it is even within the spiritual community itself of, this may be, is there a religious reason for this?
Yeah.
Am I guilty of something? Is this being caused because of something I've done?
Yeah.
We really want people to understand that that's not the case, that that's not they're guilty, this isn't a punishment.
Yes.
Again, it goes back to that genetic.
Yeah.
But making sure that they have the ability and awareness that there is help out there.
Right. Right.
That we're not going to diminish the spiritual aspect of it, because that's a huge important part for a lot of families. They want them to know that that's still there. It's an important part of their life, and that this is the support and the help is something in addition to that.
Yeah, it's good that your group, the Riverside University Health System, started this first episode psychosis program. So it was wonderful.
Yes, there's definitely a need out there, and we're happy to help as get ourselves out there and help the community as best we can.
Yeah, yeah. So for the patients that are brought to your program that are, at that moment experiencing psychotic episodes, so what are the steps taken to stabilize the patient?
Yeah, so there's a couple of steps that we want to take early on.
Okay.
The primary one is we would like to get medications involved if
Okay.
it's appropriate. It's not required for everybody, but those medications really do help with the hallucinations early on.
Right.
In addition to that, we want to get them involved with a therapist to provide a specialized therapy. We call it cognitive behavioral therapy for psychosis. And that helps out with a lot of the thought distortions, as well as the negative symptoms of psychosis, which would be problems with expressing their mood and their feelings,
Right.
and how they communicate with others, as well as getting a lot of psychoeducation to the family about what's going on, and to the members so they know what's going on for themselves.
Yeah.
One of the other parts of the model that we use, the coordinated specialty care model, is that we have a peer support who is there to kind of walk alongside with the member.
Yes.
And that's someone who has lived experience with the mental health system. So they are there as a living and breathing aspect of hope for
Right.
them to see that
Right.
someone can recover.
Yeah, I'm glad that your program is using that peer support, because that person who has experienced the psychosis and now is stabilized and now connecting with this other individual that is currently having the symptoms, I think there would be a connection, like you said, like a support that this person who's actively in the psychosis episode would say, this person went through it and now he's okay, so I think I'll be fine. I think that's a very good, program to include the peer support.
Absolutely, and that's where we see a lot of the growth in a lot of our members is as soon as that peer mentions, oh, I have heard voices before as well, or I used to have these similar thoughts.
Yeah.
Something makes eye contact of like, oh, you understand me.
Yeah.
And that's where the healing can really begin,
Because
rather than
the other person is being validated.
exactly.
I think that's the one that matters, the validation that it may be a disconnect from reality, but that person actually, he thinks that he sees and felt it.
Exactly. They're no longer isolated in their symptoms. They're no
Right.
longer they now have a sense of community. This
Right.
person has gone through what I've gone through. I'm not alone.
Yeah, that's nice.
Yeah.
So if there is one thing you want to say to our audience about psychosis, what would that be?
There's a lot of myths out there about psychosis,
Okay.
and I think that's the first things we want to dispel. A lot of those. The first is that there is help, that they are not alone in this, that they can recover, and that there is a lot of support out there for them.
Yeah.
So I want to make sure that they know there's a lot of myths out there, and that we want to combat those myths.
Okay.
That they are not alone in this situation. That there are people who have experienced it and gone on to live, productive lives. They can go back and they can go to work. They can go to school. They can have families. That there is support for them. That it doesn't have to be just about medications.
That is so true. That, like you said, there is so much future on it that, when you had that psychotic episode, that is for that moment, but then once you get the support, like from your program, then they could, as they progress, they could lead a very productive life. So thank you so much for this wonderful, informative, and enlightening conversation about psychosis,
Absolutely, and thank you so much for having me here.
Yeah, thank you. So I hope James and I were able to give you a better understanding of what psychosis is and the importance of giving support, especially when they're having that psychotic episode, until all the way of their recovery, because we wanted them to have a productive life. So, but due to limited time, we were not able to fully discuss the treatment for the psychosis. So if you have further questions, call your physicians for, you could discuss it with your physicians, or you could call the first episode's psychosis program. The number is 951-358-6005. And before we end, I would like to share with you this quote. You cannot judge a psychosis unless you endured one, just as you cannot judge running a marathon unless you have endured one. So thank you so much for watching. Always take care of yourselves, and blessings.